Here is a detailed overview of adenosine, covering all the points you've asked for. 1. Generic name, drug class, brand name. Generic name, adenosine. Drug class, antiarrhythmic agent, class V antiarrhythmic. Adenocard, adenoscan. 2. What is adenosine? Adenosine is a naturally occurring nucleoside that slows conduction through the atrioventricular AV node of the heart. It acts on specific adenosine receptors, especially A1 receptors, to transiently block AV nodal conduction. It's used as a pharmacological agent for diagnosing and treating certain types of supraventricular tachycardias. 3. Indication. Primary indication. Rapid conversion to sinus rhythm of paroxysmal supraventricular tachycardia, PSVT, including that associated with Wolff-Parkinson-White, PW syndrome. Secondary uses. Used during myocardial perfusion imaging, MPI, as a coronary vasodilator. 4. Contraindication. Second or third degree AV block unless the patient has a functioning artificial pacemaker. 6. Sinus syndrome unless the patient has a functioning pacemaker. Bronchospastic lung disease, e.g. asthma. Hypersensitivity to adenosine or any component of the formulation. 5. Before taking this medicine, precautions. Inform the doctor if you have asthma or other respiratory diseases, recent heart transplant, a history of seizures or convulsions, any implanted pacemaker, hypotension, low blood pressure, a history of long QT syndrome, pregnancy, or if breastfeeding. Important, avoid caffeine and theophylline-containing products for at least 12 to 24 hours before using adenosine, as these may reduce its effectiveness. HAS6. How to use adenosine. Administered intravenously, IV, in a rapid bolus. The injection must be given quickly, over 1 to 2 seconds, followed by a rapid saline flush. Must be administered in a clinical setting with continuous ECG monitoring and resuscitation equipment available. 7. Dosing information. For PSVT, paroxysmal supraventricular tachycardia, adults, initial dose 6 milligram IV bolus over 1 to 2 seconds. If not effective within 1 to 2 minutes, give 12 milligrams IV bolus. A second 12 milligrams dose may be given if required. Maximum total dose, 30 milligrams. Pediatrics, initial dose, 0.5 to 0.1 milligram per kilogram IV. Maximum single dose, 6 milligrams. If not effective, increase by 0.05 to 0.1 milligram per kilogram every 1 to 2 minutes to a max single dose of 0.3 milligram or 12 milligrams. 8. Miss a dose, overdose. Miss a dose. Not applicable as it's used as an emergency diagnostic drug administered by healthcare professionals. Overdose. Symptoms. Severe bradycardia, hypotension, cardiac arrest, or asystole. Discontinue the drug immediately. Supportive care and monitoring. Effects are short-lived due to its very short half-life, 10 seconds. Use theophylline or aminophylline as antagonists if needed. 9. Stop or avoid taking. Do not take adenosine without medical supervision. Avoid in conditions like asthma or chronic obstructive pulmonary disease, COPD, severe hypotension, high-grade AV block without a pacemaker. Palpitin side effects. Common side effects: flushing, 20%, chest discomfort, pain, dyspnea or shortness of breath, dizziness or lightheadedness, palpitations, throat, neck, or jaw discomfort, nausea. Serious side effects: severe bradycardia or heart block, asystole, transient, bronchospasm or respiratory distress, seizures, rare, hypotension, cardiac arrest, rare and usually self-resolving. 11. Other drugs will affect adenosine. Drugs that may enhance adenosine's effects. Dipyridamole inhibits adenosine uptake, enhances effects, may require dose reduction. Carbamazepine can increase AV block, risk of prolonged heart block. Drugs that may reduce its effectiveness. Theophylline, caffeine, and other xanthines compete with adenosine receptors, reduce effectiveness. Caution with beta blockers, calcium channel blockers, and digoxin may increase the risk of AV block or bradycardia. Anti-seizure medications may interact unpredictably. Thank you. Have a nice day.